Our guest is the Northwestern District Attorney, David Sullivan. Thank you, sir, for making time to come in. Always appreciate your time to come in and see us. There is a significant problem with heroin addiction, other opiates, painkillers, significant number of overdoses. And it's not just a problem in your area by any means, let me make that clear. But when we see numbers coming out of a rural area like Hampshire and Franklin counties, and I think it's approaching a dozen opiate overdose deaths in the last month and a half or so, catches our attention. How do you assess the situation? How bad is it? What's happening?
We're in the midst of a national opioid crisis with overdoses, and it all started with just a plentiful supply of painkillers from OxyContin on down. And so now we're kind of seeing what happens when these pills have been really placed onto the market. Heroin is so cheap. A pill may cost $20. Addiction to pills may be $300 or $400 a day. Well, a bag of heroin's $5, and it's never been more potent. So we take that perfect storm of people getting started on pills, heroin being cheap, and it being sometimes 2 or 3 times more potent than it was 5 years ago, and that's the recipe for disaster, and that's what we're seeing. What you see in rural areas is that that wave that might have hit South Boston or Worcester or Providence or Springfield maybe 4, 5, 6 years ago has now hit rural areas, and it's plentiful, and the folks that are taking it are really playing Russian roulette with the potency that's out there.
Let's talk. There's so many aspects to this, and I know you've stressed the social aspect, the treatment aspect. Yes. You've said at times, you can't arrest or prosecute your way out of an addiction crisis. You've got a task force together that's looking at this. It's multidisciplinary. If you look, it's across the spectrum. I know there was a huge meeting in Greenfield Community College, Franklin County, to try and bring the whole community in and talk about it just this week. What's the approach that you see being taken to try and combat this scourge?
The first thing is that opioid heroin addiction is an addiction. It's a public health crisis we're in. And certainly you just said it, we can't arrest or incarcerate our way out of it. We've got to help people get the treatment and the counseling and the long-term care to keep them from being addicts. And in this situation, there are no real substantive amount of treatment beds in Western Mass. There's very few. Governor Romney in 2003 cut every single detox bed in Hampshire and Franklin County and North Quabbin. So there isn't a single detox bed. And then the treatment beds, they really need to be there. We need to move from prison on demand to treatment on demand. Our prosecutors don't want to send people off to jail to detox. And I feel that's reflected, that let's deal with this as a medical crisis. Let's deal with this. If we knew that 11 people have died in our district of 250,000 people since December 15th, that rate is double the Massachusetts death rate for last year. So we're really in the midst of a real crisis where not just overdoses, but fatal overdoses.
You talk about the lack of treatment beds of facilities. I know the sheriff of Franklin County has remarked at times that his jail is really the only treatment facility in Franklin County.
Absolutely correct. Sheriff Donlin hit it right on the head. Our houses of correction are being used as our detox and treatment facilities. The only treatment and detox facility in our area is the Veterans Administration, and that's only for veterans. It's important that it's there for them, but we need it for the rest of the population to make sure that when people need help, they can get it immediately. Sometimes that window is only an hour or 2 or 3 hours that an addict will finally come to that realization they need help. And if they don't get that help, they're going to be back using again the next day. And they're going to commit crimes many times to support that habit. So it really makes a lot of cost sense. And it's really, I call it smart on crime. If you give good treatment, you give good counseling, you're going to save it at the other end in incarceration costs and in the cost of people being victimized. Very rarely, Jim, is there a breaking and entering into a home, a car, a burglary, a convenience store robbery, a bank robbery that's not opioid related. I dare say that if you ask anybody in law enforcement about those crimes in their communities, they would say it's drug related. And if we can reduce the amount of addiction and we can get people help, we're going to reduce the victimization of people in communities.
I know education, getting schools involved from a really early age and early lower grades has been something that's been talked about a lot.
I think it's essential. I think that keeping people away from those opioids and really educating people about the risks. Every day people go to doctors and dentists and they get prescribed, it might be Percocet, it could be OxyContin, it could be a knee or a back or a toothache. Did they ever ask, have you ever been addicted to cigarettes or alcohol or other drugs? We have to do a much better job of using our painkillers as a last resort, not a first resort. Opium's been here for 5,000 years. It's been addictive for 5,000 years. And I think when Big Pharmacy came in, they applied these things and said there won't be any abuse, there won't be any misuse, but in fact, millions of people have gotten hooked on these, and they're good people that never thought that they would form an addiction. But what happened, Jim, in the marketing of heroin was that not only has it been made cheaper and purer, they made it snortable, so that everybody who got kind of hooked on these pills then gravitates to snorting it, and within 2 weeks to 2 months, they're injecting it. So nobody ever thinks they're going to be a heroin addict. That was, as you know, you grew up, it was something that was very taboo. But now it's a way for people to take care of that addiction that started with a pill.
It is an illness, but it is a crime, and there is that approach to it as well, law enforcement. I know one of the discussion points at the Greenfield event at GCC was the money the governor's put forward in his 2015 budget. I think it's $2.7 million to add some additional drug courts, 5 drug courts across the state. Also courts that will deal specifically with mental health issues. It's all intertwined. How important would that be, do you think, to addressing some of the law enforcement side of this?
Well, I think the governor is shifting the conversation away from, we spend, I think, $1.1 billion for incarceration and corrections. It's shifting money away so we don't have to incarcerate people. The 2.7 is a nice beginning, but it's really a chip in the bucket. Because to have quality treatment programs, quality aftercare and recovery programs, it's going to take a lot more resources. So I think we're really looking in the tens of millions of dollars to start addressing this and to make sure that, whether you're 18 or 50, that we treat you just like if you had a heart attack or if you had diabetes, that you wouldn't delay treatment. You wouldn't say, can you wait 3 weeks or 3 months or 6 months? You'd say, we got to help you right now. We put you in the ER, but then we put you in some kind of program afterwards. So I think that's the conversation, and that's the shift. 400 people came to Greenfield Community College because they care about it. They've been impacted, their loved ones have died, or they've been addicted. And now I think people see it for what it is. It's that community disaster, when it rips apart families and communities, and they're good people that never thought they'd be addicted, but now they are. And now it's up to us to figure out the best way to kind of work on that.
Take a minute, put some personal perspective on this for us, if you will. You're a prosecutor, but you're a family guy. You work with some state police and police investigators. They've seen some pretty tough stuff. They're pretty grizzled men and women sometimes. But what are you seeing? What's the reaction? What's the sense in your office and with these investigators as they see what's happening and they see these deaths many times of young people right now?
Our state troopers go out to every unattended death, every overdose they see, and they see the family in the worst of times. Here they've lost a loved one. And so the heart of a prosecutor and of a law enforcement goes out to that family. We know that it's a completely preventable tragedy. And so I think what you'll find from almost every prosecutor to a T, every law enforcement, is that we want to get them the help they need so we don't have to put a body tag on them. That toe tag that says, here is the deceased in the morgue, that's the last tag we ever want to put on an individual. We want to make sure that people can get this help and get over the stigma. I think families have to understand that there is not a stigma to doing this. Bringing your child to a hospital, bringing them to a place where they can get help. Police want to help people get there. They don't want to end up arresting that young man or that young woman for breaking into a store to support their habits. So I think there's been a fundamental shift in law enforcement, in corrections, and I think in prosecution, so that we can start to get people the help they need and not resort to long-term incarceration.
Northwestern District Attorney David Sullivan, thanks for spending some time with us.
Thanks for having me.